Now, you can get different kinds of cannulas from different companies. This particular one is from Mertz Corporation, and there's two sizes that I use. There's the larger size, which I use on Lisa for the cheeks, and this is a 25 gauge 2-inch cannula. This one here is a 27 gauge 1 to 1.5 inch cannula, both of these. And they come in a box, and you can get multiple cannulas in one box, and this will last you through a number of patients. So you can get them from wherever you want. This is from Mertz. Filler injection on Lisa's cheeks. We're going to try to make her cheeks a little more fuller and a little more softer. And I'm going to use a cannula instead of a needle. So the way to compare this is that the cannula is a blunt tipped instrument. It's not sharp like a needle. And the reason why this is a beautiful way to do this is because you can create a tissue plane where you can instill the product submuscular or supraperiosteal. And with one injection point, I can go and fill my product without causing any edema or discomfort or ecchymosis. With a needle, there's going to be multiple sticks. That's why I love the cannula, and for the patient, it's great because there's less discomfort. So we're going to start injecting, and I'm going to show you the planes that we're going to inject. So I wanted to show you here what a needle looks like versus the cannula. You can see the tip is blunt, and the tip on the needle is very sharp, and that's why I like using this. I have prepped Lisa with alcohol, and I've marked and delineated the injection site, which is almost shaped like a triangle here. I have a port here that I infiltrated with 1% lidocaine with 1 to 100,000 epinephrine, and I've engaged this port with a 20 gauge needle to create the opening to go underneath with the cannula. And so we're going to start here, and I'm using Radiesse. You can use any product that you want. And I'm going to introduce this cannula here, and we're going to go submuscular supraperiosteal. You okay, Lisa?
Yes.
So I'm underneath the muscle. I'm over the periosteum. You okay?
Yes.
And I'm all the way to the tip there. And I can feel my cannula if I push down. And then we're going to start injecting a little bit as I come through. And I'm going very slow and retrograde. And now we reposition, come down submuscular, supraperiosteal. We're going to come back and do more injection. And then I'm going to come down. You okay, Lisa?
Yes.
So you can see there's no, we're not doing multiple sticks, so there's no ecchymosis at the site of injection. And there's no edema and very little bruising from that one injection. And you can see what's happened here is that we've created a little fullness in her cheeks. And if you compare the two sides, you can see the left side here and the right side. It's very subtle, and you want subtlety. You don't want to overdo this, and it creates a nice platform and a nice fullness over the malar bone. So the injection is done very slowly. It's submuscular, supraperiosteal, and if you need to put a second port, you can put a second port here or here and come in from that angle. I only needed one port on her, and we've got a really nice result with a cannula mid-facelift.